daily capacity for our visitors, and we require folks to go online to get a reservation in order to come into the zoo. So we want to make sure that we are protecting everybody. So we will have visual signs, staff members in place to remind folks to maintain 6 feet physical distancing along all the pathways. And we're really thrilled to announce this news because we want folks to know that as we think about this, a lot of people have not had the time to really enjoy many of Milwaukee County parks, our zoos, and it has had a huge impact on our budget. And when you think about our budget, as I said before, we're going to see about $100 million in lost revenue. We could be facing about a $450 million impact to our total budget because of the COVID-19 costs, which also hinders us from being able to do what we are achieving to do here in Milwaukee County, which is making sure that we're achieving racial equity. When we look at what has been happening over the past week and a half, we know that we definitely need to make sure that we're bringing as many people to the table and really focusing on racial equity at the end of the day. And so we are going to continue to talk about the lack of CARES funding that we have not received both at the federal and at the state funds. And so we need everybody's help in leaning on our state and federal delegations and making sure that we're bringing back as many resources as possible to make sure that we as local governments has that direct and flexible spending. We all, and when we think about the zoo opening up, this is definitely an exciting time. But we need to remind folks that we are still in the middle of a pandemic. And so we in Milwaukee County are going to continue to adhere to the CDC health guidelines in order to keep folks safe. And so for that reason, we're going to be issuing a universal face mask policy. So our employees, our contractors, vendors, volunteers, service users, and the general public who are entering our county facilities will be able, we're asking them to wear a mask, and it will be required. But we're going to make sure that we're also providing those masks for many individuals. And this is what we need to do, and not just in county facilities, but also within our airport and on our buses. So we're going to make sure that at those control points that we have masks available for folks. And acceptable face masks include cloth face masks, such as face masks that are handmade or sewn, scarves, bandanas, disposable face masks, non-medical grade paper, or procedural masks. For those who don't have a face mask, again, we're going to provide them. And like many other communities, we have spent a numerous amount of money on PPE for Milwaukee County employees, but also for the public. And with that, I want to make sure that we give a major shout out to organizations like Mask Up MKE, who we've been able to partner with in making sure that folks have access to masks. And I know people have been asking about children the ages of 3 to 12. We're saying that they should only wear a mask if a parent or guardian is really monitoring them to make sure it is safely worn. I do have a 3-year-old, and we do put a mask on her, so I know how difficult it could be really putting a mask on a child. But we want to continue to make sure that we are protecting everybody, our family and our neighbors. All children 12 years old and under must remain 6 feet within their parents or guardian or household unit. And those who are small enough should be in a stroller or cart. Children 2 or younger are exempt from wearing a face mask. And so these are our guidelines that are strictly based off of the CDC guidelines. And these guidelines will help us keep places like the zoo open and make us feel safe for all of us to enjoy. So please, please, please wear your face mask to protect you and those around you. And when we think about these face masks, when we think about, folks going to different places and things slowly opening back up, we want to let folks know that if you don't have symptoms, it's extremely important that you, or if you do have symptoms, that you get tested and understand that just because you don't have symptoms don't mean you don't have it. And that's why we're asking people to wear their mask. Because Milwaukee County is an area of significant community spread transmission, we have to take the necessary precaution in making sure that we wear a face mask in county grounds and within our facilities. And we're going to continue to stress to make sure that you put your biases aside when you see people of color wearing your mask. The other thing I want to make sure that I touch on is beer gardens. Speaking of Milwaukee County Traveling Beer Garden will officially kick off at Framing Park in Franklin tomorrow, Wednesday, June 10th. I had the opportunity to go to Whitnell Park yesterday in Greendale for the official opening. And this is a time where people feel like it's spring and summer in Milwaukee. So, and we're taking the necessary precautions to make sure that we are protecting folks. So we're asking folks not to bring your own cup. We will provide those cups, single-use cups. We are preferring that you pay with a credit card. And we do have tables with one side with a brick on those tables, one side marked with the red, another side marked with the green. And so if you're coming to the park, make sure you sit at tables with that green marking showing. That lets you know that we have cleaned up and it is safe for you to come and enjoy. And so I know this is a favorite time for many folks as we think about the fact that we're leaving the cold weather, we're going into the summer, and we just want to make sure that we keep these services available to folks. But we just ask everybody to continue to respect and follow the suggested national health guidelines to guide us as we continue to go through this pandemic. And with that, I will hand it over to Mayor Barrett.
Thank you very much, Mr. County Executive. We appreciate everything that you're doing right now. I think every single one of us is keenly aware that over the last 10 days, the focus of the nation, the focus of the state, the focus of Milwaukee has been on the situation in Minneapolis and current relations between police departments and communities, particularly communities of color throughout our country. As a result of that, we're also well aware that literally thousands, if not tens of thousands of people have decided that they were going to protest or march or show their displeasure with the current state of affairs. I support those peaceful efforts for people to have their voice heard. And I think it's important for us as a nation to embrace our First Amendment rights. I'm also keenly aware that for the last 3 months, on virtually a daily basis, we have been talking to people about the dangers of COVID-19 and that this pandemic does not create exemptions for religious events, for sporting events, for voting, or for protests. And to that end, I remain concerned that what we're seeing right now could lead to a spike. I hope I am wrong, that we won't see a spike, but my fervent belief is anybody who is feeling any symptoms whatsoever, that they get tested as quickly as possible. If you are feeling the symptoms of COVID-19, please get tested. We've got our community sites on the north side and the south side. I'll touch on that in several minutes. What we have seen is frankly, a rather dramatic drop in the number of people who are getting tested. And I would like to think that's because everything is back to normal. I don't know the reason why we've seen such a dramatic drop. But again, if people are feeling the symptoms of COVID-19, I think it's very, very important for them to get tested as quickly as possible. Again, we've got 15 sites. You can call 211 if you're symptomatic. The community sites are there. There are now 4 community sites that people can go to and can get tested. But that's very, very important. So last Thursday, I announced at this press briefing that the city of Milwaukee would be moving from phase 2 to phase 3 of our Moving Milwaukee Forward plan into effect on Friday, which is exactly what happened. Commissioner Kwolek will talk a little bit about this later on, that we are now in phase 3 of our Moving Milwaukee Forward safety plan. We understand that there still are a lot of people who are concerned, a lot of restaurants that are concerned, a lot of bars are concerned, a lot of workers who are concerned about going back to work. And as I've said repeatedly, by issuing that order, we of course are not requiring any business to be open. And we are requiring them to follow safe practices. So to that end also, both this morning and this afternoon, we've already hosted sessions on our webinar, Moving Milwaukee Forward Phase 3 for bar and restaurant owners. I was very, very pleased by the turnout. We were joined by, between the 2 webinars, 268 participants who wanted to get more information as to how they can safely reopen. So the goal of the webinars was to help the restaurants and bars understand what moving forward in phase 3 means for their businesses, for their staff, and for the customers. I was joined on the webinar by members of the Milwaukee Health Department, the Department of Public Works, the Department of Neighborhood Services, and this afternoon by the Department of City Development as well, because they're the ones that are running the Milwaukee Restart Grant Program. But we talked about issues like the Active Streets program, which is going to allow for more outdoor dining, how to safely return to indoor service, how to keep customers and staff safe, and the city's expectations as they relate to inspections and enforcement. That to me is a big part of what needs to be done as well. I touched a little bit earlier on the testing. This week, the Northside National Guard site at Custer Stadium, which is across the street from Barack Obama School of Career and Technical Education, conducted 80 tests. So again, that's a dramatic drop from what we were seeing several weeks ago. The UMOS site conducted 206 tests. Again, a dramatic drop from what it has been seen. On the South Shore, there were 206 tests that occurred. So the combined totals for the week are a little over 4,500. The combined overall totals are much more impressive at 27,000. But I want to remind people that the UMOS and Custer Stadium sites are available for symptomatic and asymptomatic, meaning if you don't show any symptoms, you can still be tested at those sites. Both sites are open Monday through Thursday, 11 a.m. to 7 p.m., Fridays and Saturdays, 11 a.m. to 5 p.m. They are closed on Sundays. If individuals who are out protesting and again begin to feel the symptoms, please don't hesitate. Call 211 to find a testing site near you, or go to one of our community sites. So with that, I'll turn it back over to you, Catherine. Thank you very much.
Thank you, Mayor Barrett. Next, we'll hear from Dr. Weston.
Thank you, Catherine. Good afternoon. First to our numbers, we have 9,001 confirmed cases of COVID-19 in Milwaukee County and 301 individuals who have died. We updated our 5 key metrics yesterday and saw the care category turn from yellow to green as we're seeing a downtrend in COVID-19 patients overall in our hospitals. This is a positive change and a good trend for our community that we'll certainly keep an eye on. On the testing front, we've seen the number of people seeking out COVID-19 tests go down over the last few weeks, in particular over the last 2 weeks. At the same time, we're not seeing a downtrend in the percent of those tests that are resulting positive for COVID-19. So this combination of 2 factors suggests that we're under-testing in Milwaukee County and missing a substantial number of cases of COVID-19 in our community. This is likely first due to diminished awareness of the presence and severity of COVID-19 in the community. As we see stores, restaurants, and workplaces opening back up, there's a sense that we're done with COVID-19. On top of that, we've naturally seen our media and our public attention shift to the protests and the very real inequities, racial inequities in our country. Each of these factors likely leads to people thinking less about COVID-19 and less people feeling the need to get tested. Testing, however, especially testing with symptoms, is critical to controlling the spread of COVID-19 and decreasing the likelihood that we'll have a major future spike in cases that could strain our healthcare system and push us back as a community to stricter physical distancing measures. So please, if you have any symptoms of COVID-19, and to list these off, we're talking fever, chills, cough, shortness of breath, new fatigue, muscle aches, headache, a new loss of taste or smell, a sore throat, runny nose, nasal congestion, nausea, vomiting, or diarrhea. If you have these symptoms, seek out a test for COVID-19 and certainly call 911 if it's a case of an emergency. So as a reminder, there's 2 main ways to get a COVID-19 test in Milwaukee County. We have 2 National Guard testing sites open, one at Barack Obama School at Custer Stadium, and that's at 4300 West Fairmount Avenue on the north side. And then the UMOS testing site, which is at 2701 South Chase Avenue on the south side of the city. So these are free, no appointment, drive-through, and walk-up testing sites. Additionally, you can simply call 211, as the mayor mentioned, and based on your zip code, you'll be routed to a nearby healthcare affiliated testing site. You can schedule an appointment at those sites for a test, and that's regardless of income, insurance status, or immigration status. So although there is under-testing in our community, it's important to note we have the capacity to test many more people than we currently are. Both our health system-based sites as well as our National Guard sites are being underutilized, and they're able to test many more members of our community. So we know that COVID-19 is very easy to spread. So if you have any of those symptoms, it's critical that you're tested and able to self-isolate if needed to prevent broader community transmission. Get tested to care for yourself, to protect your family, your friends, and your coworkers, to prevent more serious illness, and in the end, to be a good citizen and keep our community safe. Please remember, COVID-19 is still in our community, and though we are opening back up, we need to be more vigilant than ever to ensure that we don't have to take a step backward in this fight. Thank you, and I will pass it on to Commissioner Kowalik.
Hi, everyone. Thank you for the opportunity to provide an update today. As Dr. Weston noted, as far as the number of cases and the number of fatalities from COVID-19 infection, the city of Milwaukee absorbs the majority of those since we're the largest jurisdiction in the county. We're about 7,200 for the city and a little bit over 200 for fatalities. We normally have our updates at 2 p.m. every day, so I'm providing you with estimates based off of the latest data that I had as of right now. So the concerns, though, too, looking at the inequities related to COVID-19 infection, how the Latinx or Hispanic population of our city now has absorbed the majority of the cases at 39%. The African American is 32%. The white is 11%. Unknown race is 8%, and Asian is 5%. So definitely increased strategies are needed as far as outreach related to our Latinx community, making sure there's a culturally and linguistically appropriate outreach materials and really getting people involved in getting tested and providing some care. We do know that there are some solid testing points of care opportunities on the south side of Milwaukee or those areas of town that are predominantly Hispanic or Latinx. So we are looking at that too. Is there an over-testing situation happening on that side of town? But we do know, as the mayor noted and as Dr. Weston noted, that there is a decline in number of tests that are happening, not just at those community testing sites, but my understanding is some of the healthcare providers are also noting that there's been a decline in tests. Again, I know that we are at a boiling point in our country right now, and that there has been a shift in focus as far as advocating for reforms in law enforcement and just government in general related to anti-Black racism in our city and our state and our country. But we also need to acknowledge that COVID-19 is still here and it still causes injury, disability, and death. So just being vigilant about preventing exposure to COVID-19. I also wanted to talk a little bit about that. If anyone has been involved in protests or demonstration activities, just some pro tips to make sure that you're protecting yourself, making sure you're wearing a mask or a face covering. Again, making sure you're wearing it properly. I've seen a lot of folks with this. I know it's easier to breathe that way, but the mask needs to cover your nose and to the bottom of your chin. It should be full coverage at that point to really have the maximum benefit. If it's not worn that way, you're pretty much defeating the purpose of wearing it. Also making sure that you're using hand sanitizer, 60% alcohol volume or greater. As you're out and about, you might not have access to a sink, but that you're sterilizing and using that as much as possible. And then, of course, social distancing or physical distancing, 6 feet from other people in your household. We have seen some of that, groups kind of spacing out in the protests and demonstration activities. If you are symptomatic, you're starting to get a sore throat or some of those other symptoms that Dr. Weston noted, or you're just concerned, say you're not going every day, like say you went maybe on Friday. The recommendation now from the Association of Public Health Labs is to get tested 5 days after exposure or the first sign of any symptom related to COVID-19. So again, it's the 5-day mark if you start developing some symptoms, or again, the last time you went to a protest or demonstration, you should get tested. Again, there's a variety of free testing opportunities throughout the area, so please take advantage of those as testing is low. So you should be able to get in and out. You shouldn't have to wait too long. We know that many other providers also provide free testing, so that information is available on our website, 211. There's also a way for you to find out where we're at, or if you Google COVID-19 testing, it'll show you what the current testing opportunities are in our area. Also, I wanted to just talk a little bit about the phase 3 order, as this is where we're going to be for a while. We're anticipating that we'll be in phase 3 for a while. But the difference with moving through the orders is once we are at phase 3 or any phase, there's a review period. So we're waiting for one full incubation cycle to conclude before we reassess and move into the next phase. So we need to stay in this phase for 14 days, which means we will not reassess until June 19th or Juneteenth Day. So you should not receive any updates on moving into a new phase until that point in time or thereafter. If we're in yellow now, if we fall back to red in any category, and by the time we get to the 19th, we're going to note that, and we're going to have to reassess every 7 days from that point on. So it's not like, oh, well, we're looking at now, and then we're looking at next Friday, and then we transition because maybe there was one red day, say, for testing. Then we say, oh, well, by this day we have all yellow. No, it's over the entire period. So please be sure to watch for that. The county is tracking too, although our indicators are slightly different. They're pretty much the same, the cases, the testing, the PPE, the care, and the contact tracing. My other point too about this, because I know we've received a lot of questions, and I just want to shout out my team, Deputy Commissioner Claire Evers and Deputy Commissioner Marlena Jackson, who really stepped up and helped with some of these webinars and creating opportunities to provide some answers to many questions related to phase 3 and how do we go about doing that for restaurants and bars, as well as many other sectors. So there'll be a series of a variety of webinars and opportunities to get clarity on where we're at. So I just wanted to highlight the point about outdoor patios and mass gatherings, because that's a big difference compared to where we were at in phase 2 and prior. The CDC states that if anyone in a group is high risk, so you don't want me in your group because I'm high risk, so 10 people, that's the max. It doesn't matter what phase we're in. They're saying anyone that has underlying health conditions or anyone that is over the age of 65 is considered high risk. So you need to keep that group small and make sure that there's social distancing or physical distancing, 6 feet apart, and then enhanced cleaning and sanitation. If you do not have a high risk person in your group, that they're looking at the lesser of the 3. So we saw people with the 250 and they were like, yeah, I can do this, I can do that. Actually, not necessarily so. So under the phase 3 order, gathering sizes of 250 people or less must meet the lesser of the 2 criteria outlined by the CDC. So 25% of the total occupancy, that's building occupancy of the location established by your jurisdiction, which is the city of Milwaukee. And then 1 person for every 30 square feet of floor space that's open to the public. So you note that those 2 categories make a pretty big difference. So you can't just run with the 250. You have to look at whatever is the lesser of the 3. So I wanted to just clarify that because we have received a number of questions about that. We also know too that large group gathering applies to establishments that have the space for the safety protocol, so that there's adequate space for physical distancing of 6 feet or greater from another person or group. The best practices in place are meant to support the physical distancing. And this also includes outdoor spaces and patio. We know that those spaces are included in the capacity count. So it's not additional, it's part of what you already set up for. We also know that enforcement has been a question. So who's going to enforce? Enforcement is still a reality because we have an order in the city of Milwaukee. We know that our surrounding jurisdictions have guidelines, and then those are meant to protect public health as well. But our order is enforceable. The Milwaukee Health Department staff, our inspectors, do have the right to enforce, as well as Milwaukee Police Department. Our concern again is trying to limit the spread of disease in some of these areas where there's more stagnant, where there's, like we're comparing the difference between, say, a gathering where people are sitting somewhere for 1 hour versus where people are moving through. there's a difference there. And I know that was a question a while ago between like grocery stores versus like faith-based gathering. So if you're stagnant, meaning you're like sitting in the same room, breathing the same air, what we're looking at is the level of risk associated with that. So 10 minutes is what we normally go with. Anything that's more than 10 minutes significantly increases exposure. Also, the concern about the distance, less than 6 feet, is where we're concerned. So looking at those 2 points, looking at being in a stationary, stagnant situation for more than 10 minutes, and then also the distance between the less than 6 feet. So please consider that as we're moving forward on that, so we don't have any issues, because we know that everyone is pretty, this has been a long year and it's only June. And we know that everybody's excited about getting things back to normal, but we know that there's caution that needs to be considered before we do that. So that's why with phase 3, there is a 25% cap for restaurants and bars. So again, that is enforceable. We know that most people are not coming in and sitting for like 7 minutes and leaving. Again, that 10-minute mark is what we're looking at, being stagnant and not moving through. So our website, milwaukee.gov/MMFS, is where you can find the updated order as well as any other supplemental materials about it. We also will be posting the webinar information. So again, they'll be specific to sectors. So we just have restaurant and bars. There'll be one for child cares and youth programs. There'll be one for faith-based. So again, just going down the list of all of the sectors. So pretty similar to what is listed in the table, this gating criteria table that we're using. So if there's any specific questions, we'll be more than happy to answer them. And we also have our Ask MHD COVID-19 email that is available, and we have been receiving a number of questions about phase 3 through this means, but we set this up so that we're not getting specific emails to various health department staff and then say someone's out or someone is busy meeting or doing things and they're not able to respond right away. We set that up to provide a quicker turnaround on responses. So thanks again. Stay safe.